You're watching WSBT-22 News at 5.
Time is brain. That phrase sums up the singular most important thing you need to know about a stroke and your chance of surviving it with any quality of life. WSBT-22's Bob Montgomery spoke to a local doctor who had a stroke. In this month's Eye on Health, he explains why the immediate help he got saved his life.
To get back things is to...
It was a normal Monday morning just over 6 months ago when Dr. Thomas Fischbach realized something suddenly wasn't right.
I was just doing my daily morning routine, teeth brushing, getting dressed, and I went to put on my watch and I noticed my left hand didn't feel right. But it wasn't dramatic, it just kind of felt asleep or numb. And so I thought, although I'd been up for half an hour, could the sense in my legs.
Fairly quickly, that off feeling was traveling all over the left side of his body. Dr. Fischbach knew he was having a stroke and immediately called 911. That first step, he says, was critical to not only saving his life, but his quality of life. That allowed the EMT to do a field assessment and tell Memorial Hospital to activate the stroke team before he arrived.
Because in a stroke, like a heart attack, time is a critical element for being able to have some chance of as much recovery as you can.
Because the stroke team was prepared for his arrival, it was able to quickly assess not only the type and area of the stroke, but the appropriate way to treat it. In his case, a medicine called TPA was used. It dissolves the clot, reestablishes blood flow, and rescues the area in danger.
From the time I made my 911 call to actually getting the infusion was barely little more than an hour. And basically within about 2 hours, maybe a little bit less, I started having some improvement.
Images all in real time.
Dr. Luis Lopez is the medical director of the Beacon Health Stroke Program. He says Memorial Hospital has the highest level of stroke certification in our region, called a thrombectomy-capable stroke unit.
We were not just able to give medicines, but then now we're actually certified to be able to remove clots from the brain, bringing the level of certification to our community here and the surrounding communities of somewhere that, you know, within a 65-70 mile radius, we are the center affording the opportunity to not use up time in sending them to a very faraway place.
Dr. Lopez emphasized the emergency nature of not ignoring stroke symptoms.
For every 15-minute delay, there's an increase in 4% by the disability of likely outcome in terms of that patient's, results. It is impressive as to the amount of brain that goes away in just a short amount of time. In the first 60 minutes of interrupted blood flow, 122 million neurons die.
To put that into perspective, he says we naturally lose about 31 million neurons in our brain each year. Losing 122 million neurons in 1 hour means our brain is aging by a week and a half every minute after a stroke. In the studio, Bob Montgomery, WSBT-22 News.
Well, to mark Stroke Awareness Month, Dr. Fischbach will throw out the first pitch this coming Friday at the South Bend Cubs game for the Strikeout Stroke event. All right, an increase